Thank you, Dave. Well, you may have noticed my red dress today. That's because it is National Wear Red Day. It's a campaign created by the American Heart Association's Go Red for Women movement to raise awareness about heart disease in women. Now, although heart disease is about 80% preventable, it kills 1 in 3 women every year. You can help spread the word today by dressing in red, of course, and also encouraging women to learn their risks. So to talk more about National Wear Red Day, let's bring in Dr. Suzanne Steinbaum, volunteer medical expert for Go Red for Women. Thank you so much for joining us today. And I mean, my husband made sure to wear red also, and to tell all of his colleagues to wear red too. It's one of those days. But why is National Wear Red Day so important?
The first Friday of February every year, we go red to bring awareness to the fact that heart disease is the #1 killer of all women. In fact, more than all cancers combined. So today's the day when we really understand what our risk factors are, know our numbers, our blood pressure, our cholesterol, our sugars, and really pull it together to change our lives to become as healthy as we can by eating right and exercising and, of course, managing our stress.
So we have some of the risks up on our screen right now: high blood pressure, high cholesterol, high body mass index, smoking, and of course genetics. Are there certain groups of women who are going to be most affected by this or more at risk?
Latina and African American women are disproportionately affected by cardiovascular disease. But what's really interesting is that we're seeing an increase in heart disease in women younger and younger. Yeah. Gen X, millennials, we're seeing heart disease in this population that we never considered to be at risk. So it's concerning.
And do we have any idea why that's happening? Why, Latina and African American women are more susceptible to something like this?
The risk factors are greater. In fact, by age 20, 50% of African American women will have some form of cardiovascular disease. And very oftentimes that's in the form of high blood pressure. So we really have to look at that family history, and we really have to look at all the things that we're doing in our own lives in terms of diet and exercise that can impact these risk factors.
Right. Now, what about the access to education materials about this? Because, I'm going to be 30 next week, and I don't necessarily think about my heart health. I'm active and I work out and eat well. But I hear that you're saying they're getting younger and younger, and that's scary to me.
Well, I appreciate that. This has been going on for 18 years that we've been doing Go Red for Women, and we've really been trying to talk to younger and younger women because it takes so long for heart disease to develop that if we start younger and younger, we can actually prevent it. And as we're seeing these statistics, we know that younger women are not immune to this, that the risk is there. In fact, women in their 30s and 40s are twice as likely to die of cardiovascular disease than breast cancer in that age range. Wow. So all these women that thought it wasn't their problem really need to start focusing on this.
And definitely, don't panic, everyone who's watching right now, because there are things that you can do to promote better care for your heart health. So what would some of those things be?
The most empowering thing is that 80% of the time heart disease is preventable. And that's really through those lifestyle choices we make. It's about the food that we eat: multigrains, vegetables, fruits, low sodium, limit those sugary drinks, really pay attention to what you're consuming, and then exercise. And that doesn't have to be crazy. We say in the American Heart Association, 30 minutes, 5 days a week, that's 150 minutes of moderate intensity exercise is enough. And managing stress, it's been a really stressful couple of years. So figuring out how you can deal with all of these things that have come at us is really important and a critical piece.
Absolutely. All right, Dr. Suzanne Steinbaum, volunteer medical expert for Go Red for Women. Thank you so much for joining us this morning. Appreciate your time.
Thank you for having me.